Facebook. How are you? Give me a moment. I'm just going to sign on here for Instagram. Come on in, everybody. Come on in. We're going live here on Instagram now. Hi, Facebook. Hi, Instagram. How are you? We are going live here. Welcome back for another episode of Let's Talk Tuesdays with me, Dr. Elisee. So good to see you all. So I'm going to go ahead and wave here in the comment line. As you guys come in too, go ahead and wave and say hi. I want to make sure our voice is being projected well and the sound is coming up well as well too. I see some people coming in already. Wonderful. Hi, how are you? Welcome. Welcome, welcome. Hi, Dr. Mashika. Good seeing you. Thanks for joining us. Go ahead and wave when you come in. We're going to get right into our teaching for today. As you know, I'm always so excited to come in and talk to everyone about what's going on, what's important with their health. And then, you know, I really started thinking about this. So initially when I started doing these Let's Talk Tuesdays, I just thought, okay, I'll do one or two because there was something that came up that I saw over the weekend. If you remember, it had to do with painting. And then now we're about like 3 months in now and pretty consistent, our Tuesday nights. And, you know, it's great when people really take their health seriously. So I say that you're taking this seriously, you're coming on in, and it's Tuesday Transforming Your Health. So I decided that I'm going to call everyone my Tuesday Transformers. You guys are my Tuesday Transformers. So go ahead and type that in to the comment line. Tuesday Transformers. So I want to say hi to my Tuesday Transformers who are all about transforming your health as you come on in. Hi, Queen Diddy. Good seeing you. Go ahead and type Tuesday Transformers into the comment line because that's what you're doing. You're here to transform your health on Tuesdays. And, you know, that's not everyone, unfortunately. A lot of people want to speak about how they want to transform their health, but they don't do that extra to actually do it. But that's not the case for you because you're here Tuesday night to transform your health. So I want to give it up for all my Tuesday Transformers. Welcome back. So we're going to get right into our teaching. Once again, I am Dr. Elisee, board certified family medicine physician, CEO and co-founder of Cornerstone Medical Group. I provide simple, concrete understanding to what's going on in your body so that you can identify two things. One, how it's affecting your overall well-being, and two, how it's affecting your daily productivity, all right? So we all want to be more productive. So how do we do that? How do I do that? Well, I do that through my medical expertise, and I also do that through my restorative approach to patient care, reconnecting the physical, spiritual, and mental components of your health so that you can enhance the quality of your life. So let's get right into our talk today. We are talking about gout. So gout, go ahead and put gout in the comment line, G-O-U-T, gout. We are talking about gout today. Go ahead and put gout inside the comment line because I want to talk about that. And I'm going to start off with one of the first times as a patient, when I saw a patient with gout. It was when I was in residency. I actually did my residency in Belgrade, Florida. And if any of you are familiar with Zora Neale Hurston's book, Their Eyes Are Watching God, that book is written about Belgrade, Florida. So it was quite a treat to see all sorts of things going on in Belgrade, but that's a whole nother topic. So when I was in my second or first year, saw one of residency, there was a patient that came in. And just so you know, there are patients that we call frequent flyers into the ER, all right? We call them frequent flyers because they're the ones who kind of come in a little too often. Sometimes it's for one thing or another. Sometimes it really isn't anything. Well, we had one frequent flyer, and in his case, the reality of life happened to him. Life happens to people. And a lot of times when people are addicts or they have drug abuse, it's really just comes down to life happening to them and they're trying to numb the pain. So this gentleman was one of those frequent flyers. He was trying to numb his pain, and he usually came in with just completely intoxicated. He had a lot of difficulty with his alcohol abuse and use. And there was a day that he came in, of course, and he couldn't recall anything that happened from the night before, but you could smell the alcohol on his breath. And I remember looking down at his foot and thinking for sure, this guy has a fracture. Absolutely, definitely, that's a broken bone. He doesn't know what's going on. I see kind of scratches on his leg, on his arm. So I said, definitely this is actually a broken bone. So we went ahead and did the x-ray, and I was expecting to see a broken bone just because of the amount of pain that he was in. I mean, to touch, it was very painful. Just looking at it, it was swollen, it was red, that spot right there at his joint. And I said, absolutely, this is a broken bone. To my surprise, when we did that x-ray, it wasn't a broken bone at all. He was actually suffering from an acute flare of gout. So when I say gout, I want you to say pain and go ahead and put pain inside the comment line. Gout equals pain. Pain equals gout, all right? Gout equals pain, pain equals gout. Now, if you do not suffer from gout, that's a wonderful thing, because the extent of pain that someone is in when they're having an acute flare, it really is like a fractured bone. There was a woman that I spoke with, and she even said that, you know what, really, Dr. Elisee, this might very well be worse than childbirth. So gout, pain, pain, gout. So let's try to find out what we can do for those of you who do suffer from gout to avoid that flare, avoid the acute flare. But before we talk about that, let's talk about what gout is. So gout, there's different reasons why people get it. There's some familial links to it as well too. They do see a correlation with individuals who suffer from gout. They actually are obese. They have other comorbidities as well. So other illnesses, when we talk about comorbidities, diabetes being one of them. And then interestingly, estrogen in women, that protects us for some reason from actually having this gout. So we see it more in postmenopausal women because the estrogen levels went low, and we see more gout occurring in men because, well, they have more testosterone than actual estrogen. So big ups one time for all of our estrogen that's helping us stay away from that pain and gout. So that's some of the reasons why people actually get gout and why they actually have that diagnosis of gout. So now let's talk about more on what causes an acute flare. So when someone comes in with an acute flare of gout, they are in an extraordinary amount of pain. They are in an extraordinary amount of pain. And that's one of the key things. It's usually just to one joint. So one joint is in an extraordinary amount of pain, usually at the big toe, but it also can occur at the knee. But more commonly, we see it in the big toe. They can't ambulate. Their body cannot take on the weight. So that's what makes you think more of this going on and being more of a fracture that's going on. And that's because the body has now had an increased level of uric acid. Uric acid is at an increase when someone has an acute flare for gout. So in the hospital, we just call it UA. So go ahead and put UA inside the comment line, UA. So that UA in that comment line, that stands for uric acid. That's what I check in the hospital when you are coming in with an acute flare. But I don't have to have that high in order to say this is an acute flare of gout. Sometimes the clinical symptoms alone will do that. So the uric acid is high. When that uric acid in the bloodstream is very high, that's the indication that this person's having an acute flare of gout, and now we want to give treatment for that. The treatment for that is immediately NSAIDs. 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 So this is your indomethacin, all right? NSAIDs. That is something I do want you to put in the comment line so that you can remember. The indomethacin, not aspirin, that's not an NSAID, not Tylenol, that's not an NSAID. That's not going to touch the person's pain, but we want to give them the NSAIDs to go ahead and treat it, right? So we spoke about what gout is. We spoke about what I look for when you come into the hospital, or even in the outpatient setting like where I am. I'm able to go ahead and just from the history be able to say this is what's going on, and I don't necessarily need the blood test, but then I do know I need to give you NSAIDs, all right? So that's the indomethacin. That's not aspirin or Tylenol. So now for the good stuff. How do we avoid gout? How do we avoid gout? So foods that are high in purines, they are the ones that usually cause that uric acid to go up. For some reason, the patient's body can't break it down. The uric acid goes up. And foods that are high in purines are the foods that are like red meats. So our red meat are high in purines, seafood high in purines, and beer. Beer also, for some reason, it's very high, and the beer can also cause that acute flare. So the number one thing that you want to avoid, the number one thing that you want to avoid to take you away from having an acute flare is you want to cut back on your beer. So beer. So we want to avoid beer. So put beer inside the comment line there. Beer, that's what we don't want. If you are someone who suffers from gout, if you've had a 6, maybe 9 pack the night before, more than likely you're going to wake up with acute flare. All right, so avoid the beer. Stop the beer to avoid that acute flare. The other things that we mentioned are now really our foods, our purine diets. So this is our red meats. This is our organ meats. Those are the things that also are high in purine diet. The organ meats, the red meats, the wild game. Those of you who enjoy wild game meats. So remember, I'm Dr. Elisee. So I always want to make something simple for you so that you could understand what's going on. So truly what I call this is the Super Bowl Sunday diet that you want to avoid. So put Super Bowl Sunday. Super Bowl Sunday diet. That's what you want to avoid so that you could keep away from an acute gout flare. So why do I say Super Bowl Sunday diet? Super Bowl Sunday diet, because of those of you who watch the Super Bowl, or if you have been invited to a Super Bowl party, what do we have? We have wings. We have fried wings. What do we have? We have beer. What do we have? We have crab legs. What do we have? We have shrimp. All that good stuff, and all of that good stuff. We have heavy meats, right? So we have the steaks. We have those heavy meats, those red meats. All of those foods equal what I say is a Super Bowl Sunday diet. And that Super Bowl Sunday diet is the number one thing that can cause an acute flare to gout. Now, I've had some patients ask me, well, particularly the week prior to Super Bowl, they'll come in and they'll say, Dr. Elisee, can I still go and have my Super Bowl Sunday diet? Can I still enjoy that food? And then I'll just go ahead and said prior to, let's not do this. Let's cut back. Let's use moderation. Let's use moderation. So again, the Super Bowl Sunday diet. So that's number one. The beer you want to avoid. You want to avoid those heavy organic meats.